Hi, this is Jim. It's Sunday, July 26th. Let's get to the Georgia COVID-19 numbers for today and a look back at the week that was. Today's report, we saw, a mixed Sunday. I would love to say, hey, look, we were down over last Sunday. Things are getting better. I just don't know based on the volume of testing, which was a little off. That contributed some of it, but not all of it. So maybe it is better. The data has just been coming in so inconsistently lately that it's hard to lay a trend on 1 or 2 days. So, I can say 7-day average for cases is near high, 7-day average for tests is near high, 7-day average for hospitalizations is high, deaths is high. We're near the top. Now, is this going to be a flat top or is this going to be something that starts to decline? Not sure. The only glimmer of hope I can say is if we look at GMA hospitalizations, we're going to see that they were down, and they've been down a couple of days this week. But if you look at Sunday over Sunday, we're actually seeing that the population of the hospital's beds with COVID-19 is still up 40 over last week. So we're up, we're higher. There's not a lot more to say about that except for it's just something we need to keep watching, and we need a few more days of a trend before we can really call it a change. And the other comment I made on this in the weekly post thread was, has behavior changed? Do we think that behavior has changed enough that people aren't out there spreading it? And, I don't see a lot more masks out there. When I do tend to venture out, it makes me wonder if the behavior has changed enough for us to really see a benefit. So I talked about new hospitalizations. I talked about deaths. Let me go into the CCU update. And you'll see if you look at the capacity number that's here on the right here, we only have 4 CCU regions that are higher than 90%. So that is good news there. In the CCU list, if you remember yesterday, we did not have Saturday's numbers. So taking a look at Saturday, we were at 6 areas with CCU usage over 90%. But as I move up to today's data, we've dropped down to 4 of those areas. So on Saturday, we saw Athens drop down to 84%. They're now back at 86. That's Region E. Shoreline came back in at 91%. That's Region J. They dropped back down, so they're fluttering right above and below that 90%. I mentioned this the other day too. On the weekends, we tend to see more discharge that admits, especially when there are things like non-COVID surgical activity, those kind of things. So, non-urgent care, but things that would require you to go into CCU after a surgery. So we'll see if that picks up again this week as we start off the week tomorrow. We saw the Waycross area add some more beds. That's Region M. And so they fell off, and they're actually down to 74% now with 19 beds free. So the 4 areas we're still looking at with high CCU usage would be the Macon area at 93%, the Oconee Milledgeville area at 95%, the Tifton Valdosta area that's coming in at 92%, and then Northwest Metro, the Kennestone area, the Cobb, Douglas, Cherokee County area, they are up to 94%. They did add a couple of beds as well, I noticed, over the last few days. So CCU does appear to be getting better. Time will tell if that's a weekend thing or a trend thing. On to the weekly. Taking a look at what happened this week, we saw tests go down a little bit, and I think that's surprising given the fact that we had so many people out there testing, and testing demand was still there. So I think we're struggling with capacity a little bit. Now, Governor Kemp did say some more capacity would be coming on. We saw that big day on Friday, but that really just kind of caught us up to the week before. So testing was off about a point, a little more than 1 percentage point. Cases were off 5 percentage points. So are we saying that that's good? Is the whole cases versus tests and how many we do and when they're published, is all coming into playing a role. We did have this week on Friday, we had the record day for new cases, but it did not kind of push us over the top. So a lot of times all you can do is watch these things and not make a definitive line drawn here or there. So that's what we will do on this one. As we go down to hospitalizations, you see we had a record hospitalizations week. When we talk about the tests and cases data, a lot of that is very automated. So it's put in electronically by the testing labs. They say, hey, we processed 300 tests and 100 or 80 were positive, or whatever that number might be. On the hospitalizations and the deaths, this is a manual process. This is hospitals reporting and doing the analysis and putting it into their local health agencies and then getting this into the state. So it's not surprising that this data lags, and I would point to the Sunday death data as the consistent measure of that. Face it, it's paperwork. It's going to get put behind patient care. It's going to get put off on a Sunday when health departments are not open. So this is why the tea leaves are even harder to read when you look at hospitalizations and deaths. That said, they are both up significantly enough that I feel like it's a pretty valid trend here. More than 2,000 hospitalized this week. That averages 12 people an hour getting admitted to the hospital. So imagine one giant state hospital where every 5 minutes somebody else is getting admitted for COVID-19. That was the week that was as far as COVID-19 in Georgia. Now, one more piece of context here. Look back at the first 3 weeks of June when we had 700, 500, 600. Combine all those three together, we still admitted more people than we did for most of June just this week for COVID-19. So it really has been a significant hospitalization jump up. Very similar on deaths. Deaths almost doubled what we had reported last week. We are 50 more deaths than even the highest week on record we've had for COVID-19 this year. We know that the state has said some of this is reporting lag, but some of it isn't. And a lot of it is related to this spike in cases we've been seeing. One other piece of data that I'd like to show related to deaths, just to give people a feeling for, the question and the comment that has been coming up. Well, we had fewer deaths. Yes, we have up until now. But let's look at it from a deaths as a percentage of cases perspective. So here's a piece of data that I built today. And basically all this does is it says how many deaths were there in a week, and those are the columns you see, divided by how many new cases were there in a week. So what percentage of new cases every week ended up in deaths. And we stayed, if you look through kind of mid-June, we were around 4% of cases ending in death. Some of that was self-selection. We weren't testing people we thought were asymptomatic, or we were only testing people who were symptomatic. So if you're not testing everybody, the people you test are more likely to have it. They're more likely to show up in the register of fatalities. Now, on the other hand, as we've tested more people, that number has gone down, and the true number of deaths have gone down up until this week. Some of that is better care. Just we understand better ways to treat it now. We're not trying to decide between one drug or another and how those things work. We've also seen a younger group of people in the case group. So the average case back in March or April, that person was in their 70s. Now they're in their 40s. People are more equipped to handle this, and even a higher number of people are in their teens and 20s. So all of these are a factor that you can't just draw a line and say, well, hey, we figured out how to keep people from dying. Not necessarily when you look at which people are dying and what's going on here. Last point on this chart, we've seen the deaths over cases number percentage coming up closer to 2%, where we were down in the 0.6, 0.5 range over the last few weeks. So that number is creeping back up. If you take the total percentage of deaths versus cases since we started counting back in early March, you're going to see that mortality rate is about 2%. So 1 in every 50 people who catch COVID-19 in Georgia are dying. Good news is that seems to be improving. I just went through all the factors, so I'm not going to really get into more and more data on that right now. So those are the charts for this Sunday. Throw an opinion in here for a minute. I am not liking people saying this is the second wave of COVID-19 in Georgia. And all I think we need to do is go back and look at this chart, right? Tell me when the first wave ended when we look at the cases per week, and then I'll tell you it's the second wave. But all we did was go to flattening the curve to a giant ramp up. And maybe we're starting to flatten that curve again, but I don't think it's reasonable to say we've ever had a first wave and we're starting a second. So just wanted to get that out there. If you're having coffee or cocktail conversation with your friends, don't let them tell you that it's the second wave until they can tell you when the first wave was over. That's going to be it for today. Hope you all had a terrific week and a safe week. Back to it Monday. I appreciate everybody checking in. Don't forget, discussion link is below, and you can come talk with us about this on Reddit, or just leave a message and we'll get back to you. Have a terrific Sunday afternoon, and we'll talk to you soon.